Hi, my name is Daniel, and I'm going to talk to you today about the facial nerve recovery of the seventh cranial nerve and what happened to me. So in 2018, I had surgery for microvascular decompression because I had a blood vessel and a nerve that were interacting with each other improperly. So the surgery took place and it was a complete success from everything that we could see. But unfortunately for me, I ended up with an infection, so they had to open me back up and go back in and clean out the infection. Now, as a result of that, I ended up with the entire left side of my face dropping down, as you'll see in these pictures. And, it was very difficult to even get up in the morning and look in the mirror. When all your life you're looking at a person in the mirror, then all of a sudden there's a different person there. So I guess what's most important for anybody out there that might be starting to go through a Bell's palsy or a surgical infection, type of influence on the nerve like I had, it's devastating, obviously. You're feeling it, you understand it. But, it's just like 12-step programs or anything else. It's one day at a time. And it's about trying to get it all back. Now, I am 5 months later and still not back. All right, but my face has come up a long way. I feel a lot better. I am not totally there yet, but one day at a time. I would have to, slowly understand that slowly it's going to recover. It's not easy to go through, but if you're out there struggling with this today, just understand that some people in 3 weeks to 6 weeks will have it back. Some are going to be 3 months to 6 months. Some 6 months to a year. So my next upcoming appointment with the doctor is going to be next week, and I'm going to find out whether or not we're going to do a nerve graft, because there's only so much that has been responding back in on this side. Actually, the real bummer about this is I had gotten Invisalign braces a year and a half ago to straighten out my teeth, and they're nice and straight, but now I can't see half of them because I still don't have the control over here to give the smile up and this lip down. So I'm kind of left with a kind of a messy smile. And I got on the face when it's still, I got kind of a little bit of a dimple here while there's nothing here. When I smile, I get a real dimple and kind of a creased dimple. So obviously, for my forehead, the lines here, still not back. For the eye, I had a weight put in the eyelid, and that's going to be coming out soon. And that was so my eye would close while I had the droop of the face. I still do not have the ability to do the thing with the nose when you get your nostrils to flame out. This one won't do it yet. So I still have nerve issues here, 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 and here. Luckily for me, some of it's come back over here. So how did I like the recovery or doing my recovery? I gotta be honest, I was really, really, really disgusted with my recovery up until the 3-month point. And that's when I took it into my own hands and I decided to go for a more holistic approach of medicine. And I went to an acupuncturist in New York City. And the acupuncturist is a great guy. And he started working with me. And also I started going for neck and skull massage therapy. Because I had such damage on this side of my body, and I believe it's from when I was strapped down for the surgery, for the brain surgery. There was a tremendous amount of muscle damage in here, so I had to get that taken care of. And also the skull, there's a hole about that big in the skull and around that area, so I couldn't snap my neck like this, So I had to find a way to get that stuff worked on. And between the acupuncture and all the therapy, the facial neck and all that, I believe that is what started to regenerate at least a part of this that I have that is returned. And it certainly makes me feel a lot better when I look in the mirror and I see it. When I work in a field where I use video a lot, so I do not like the idea when I look at my videos that this side of the mouth is not moving properly. But I'll get there one way or the other, either through a nerve graft or maybe some other stuff that they'll have to do. I was thinking, hey, even if they took 5 years off of me, that'd be pretty cool too. So, we'll see what happens. If you're struggling with seventh cranial nerve damage, hang in there. It's going to be okay, hopefully. No guarantees, but give time. Don't expect it to happen overnight. And don't stop looking at yourself in the mirror. Just try to keep your chin up and And, well, keep your face up, Just try to do whatever you can, but hang in there. Take care.
And I almost forgot, living here in Orlando, you know, trying to cover up my face to go outside wouldn't work too well all the time wearing this type of thing, which is supposed to be worn in the winter. So don't go out disguised. Just go out as yourself. If people look at you funny, let them look at you funny. It'll give you more compassion for other people down the line. Take care.